all this was about the education sector. But are these intelligence tools only limited to the education sector? No. Intelligence tools are used, like I said before, almost in every field of human endeavor. Next, let's look at these intelligence tools in the healthcare, in the health sector, because that is also another huge field where robots have been employed. Now, one of the key things that happen at hospitals, of course, in addition to, oh, I'm sick, I'm not feeling well, please give me some medication, is carrying out a surgical operation. A person who needs a surgical operation is taken into an operating theater, and you've got specialized people, specialized doctors coming in. They cut open, whatever part of the body requires a surgical operation, and they do magic on that. And afterwards, wrap it up, and then the patient is taken back to the ward to recover. Now, such surgical operations sometimes are complex and time-consuming and very risky, not just to the patient, but also to doctors, because these are human beings. They can't be made to be on their toes for 5-7 hours just to do one operation. The concentration levels will start going down because they are getting tired. As such, you've got robots that are now capable of performing surgical operations in hospitals. So patients, robotic surgeries will be carried out with minimal risks. Why? Because these robots will do exactly as they are told, and they are not going to say, oh, this operation has been going on for 4 hours, I'm tired. No, the level of concentration, the level of concentration dropping down? Nah. Robots will keep working and performing their duties diligently without getting tired. And that is one of the things that has made them extremely useful in hospitals. But also, when it comes to human health, especially in matters of life and death, robotic surgery can give intriguing results. In some cases, they could even be better than human beings. Data, for example, from past surgical operations can be used here by robots to inform new surgical techniques. In case in the previous surgical operation, the patient had one challenge in one area or another, this time around, if the surgical operation will be performed by a robot, the robot will be able to gather data from the previous surgical operation and say, okay, last time patient A had this problem. So this time around, we are not going to do that. Whereas when it comes to human beings, it will have to be, where did we put the file? What happened? And if the surgical operation happened in another town, forget it. They might not even have data from the previous surgical operation. Now, you look at the statistics worldwide. Here in Zambia, or in Africa more especially, the ratio of medical personnel to patients is very, very poor. We have so many patients to one doctor or to one medical person, and the ratios are imbalancing. As such, because of this, lack of proportion, where, for example, the UN statistics would tell you, you should have, in a country like Zambia, one doctor maybe attending to maybe 10, 12,000 patients. it's extremely difficult to find such ratio in operation in most hospitals. Majority of the hospitals, the medical personnel are overwhelmed. Far too many patients to fewer medical personnel. As such, when you use some of these intelligence tools in the medical field, you can get rid of that challenge. Why? Because there are robots that are known as virtual nursing assistants. With the introduction of virtual nursing assistants, it means you don't have to cry about fewer medical personnel assisting the patients. These virtual nursing assistants are able to interact with patients, advise them of the most effective care settings. They are available 24/7. They don't get tired. They can answer questions, monitor patients, and even provide answers. Because of that, the medical field is happy that robots are helping to solve or to provide solutions to what is being faced in many hospitals in Africa and in Zambia in particular. Now, when it comes to clinical diagnosis, robots are being employed, especially when it comes to cancer issues. Robots are being employed to screen skin and breast cancers. Okay? You don't have to have a doctor, a human doctor, performing these screens. You can have a robot screening the skin, screening the breast in order to ascertain whether or not there's cancer developing. And because these will provide accurate results, chances of having that patient diagnosed and even being put on specific medication are extremely high. You want to know as soon as you can when the cancer is starting to develop so that you can put measures to eradicate it in the patient. And that can easily be done by robots. In a hospital setup, there are so many routine administrative tasks, from, helping the doctors push the trolleys, prepare this and that, medication. The robots can actually do that to allow the doctors to concentrate on more important things. Even technology such as voice to text can help to order, like tests, if tests have to be carried out on a particular patient. Prescriptions, maybe a patient needs this specific medicine. Robots can prescribe the medications. They can even write, chart notes. They can also advise treatment plans after analyzing huge volumes of data. And that is, again, one biggest advantage with robots. Now, there are times when patients have to undergo some scans, maybe brain scan or particular parts of the body need to be scanned in order to help the medical people, the doctors, to ascertain the diseases, the illnesses they are going through, and the possible medical treatment that they need. So, imaging is one key concept within the hospital that helps doctors to know the right type of medicine to offer to somebody who's got an illness. The analysis of such images sometimes take time, and you have to have dedicated personnel to do that. With robots in place, they can analyze 3D scans, and they can do that thousands times faster than a human being. Where you have to wait maybe for 20 minutes for a human being to scan, analyze, and give you the results of a particular scan that they did, A robot can do that within a minute, everything done, and pictures, medicine, recommendations, all done and given to the doctors for speed recovery of the patient. So that again is a big advantage in the image analysis and collection of data and the required treatment by the robot.